record.
So we had case study number 2, which was Mr. Brunswick, and we chose the following 5 interventions, strategies, postures, and exercises recommended for him according to his case history. So the first 5 that we chose were thermal tactile stimulation, also known as TTS. We also chose the Mendelssohn maneuver, the Masako maneuver, which is also known as the tongue hold maneuver. We wanted to implement oral care education, as well as him practicing having throat clears after PO trials. So I'll be going over why or how to address why they pertain to Mr. Brunswick, as well as how to complete it during therapy. So for TTS, this would be beneficial for Mr. Brunswick because of his asymmetric and gag reflex, which is diminished on the left side, which is causing his inability to volitionally swallow. So by completing the TTS, the SLP would use a cold cotton swab against the anterior faucial pillars to trigger a quicker pharyngeal swallow. So by using TTS overall, it would just provide posterior oral awareness, resulting in increased gag reflex since it is absent according to his case history, as well as a successful pharyngeal swallow. So with the Mendelssohn maneuver, we wanted to implement this for Mr. Brunswick so we could address his weak laryngeal elevation. With this maneuver, it's going to increase the duration of hyolaryngeal excursion to, provide protection for the entrance of Mr. Brunswick's airway. By doing this specific technique or maneuver, he would trigger a dry swallow since he is NPO, or we decided for him to be recommended with NPO, and he would have to hold his thyroid notch for 3 to 5 seconds. So you would basically hold it up 1, 2, 3, or 4, 5, and then you swallow, which would be implemented in therapy. We are recommended for a total of 5 times during his hour sessions. The third one that we chose was the Masako maneuver, also known as the tongue hold maneuver, and that was implemented for him to strengthen his pharyngeal constrictor muscles, by protruding his tongue between his teeth, holding it in place by gently biting down on the anterior portion of his tongue, and maintaining that posture while performing a dry swallow. We wanted to do this exercise and thought that it would be implemented for Mr. Brunswick because he is a patient that does have excess secretions in his oral cavity and maybe even his pharyngeal walls as well, which is causing his wet, gurgly vocal quality, which is, pertaining exactly to Mr. Brunswick's case. So we thought this would also be a really good maneuver to implement. We also thought education of oral hygiene was of utmost importance for a patient like him, because in the case history, it was stated that he does not perform good oral hygiene, as well as because of his history of drug abuse with heroin, as well as with alcohol. It did create damage to, just the overall care in his mouth. So we wanted to implement that. So proper oral care will prevent aspiration pneumonia from occurring. It also just reduces the risk of aspiration pneumonia and prevents any harmful bacteria or saliva from occurring. Lastly, we decided to do a throat clear because of the excess secretions he's presenting with. Implementing use of throat clear for him is important to elicit a productive and stronger cough when he, does need to project foreign materials from entering the airway. So same thing with a throat clear. It's kind of self-explanatory. You just kind of do this. And then that way, he is able to protect himself if he were to be later recommended with a diet that's not NPO, that we could elicit those strong coughs. So then now Nicole will be talking about the reasons behind why we chose those 5 maneuvers, because I talked about, how it addresses and relates to Mr. Brunswick, but she'll be talking about the evidence-based practice of what each of those 5 maneuvers, strategies, postures would entail.
Yes, thank you, Nicole. So those are the explanations of what we chose and why for Mr. Brunswick. And now I'm going to go over which of these practices are evidence-based and which are actually not. So the Mendelssohn maneuver, the Masako maneuver, oral care education, and throat clear are all evidence-based practices. However, TTS is not an evidence-based practice. According to Mikolo et al. From 2012, an article, the Mendelssohn is actually used to treat patients with pharyngeal dysphagia and has been for many years as a compensatory and rehabilitative strategy. Much of the research has supported the use of the Mendelssohn maneuver for its short-term and its long-term effects, with its laryngeal elevation and its prolonging in the duration of opening the upper esophageal sphincter, also known as the UES, and also the overall physiological effects of the swallow. According to Bayan 2016, the Misako maneuver also has various research supporting its exercise to strengthen the swallowing muscles. Evidence shows that this exercise is widely used amongst clinicians, and the current literature also suggests that the Misako maneuver can actually result in increased pharyngeal constrictor strength, which will then result in improved pharyngeal pressure during the swallow. According to Remin et al., also 2016, adequate oral hygiene and care has been shown to decrease the risk of aspiration pneumonia, and it will overall promote safe and healthy ethical aspiration guidelines. According to Bonilla from 2012, the cough reflex is crucial in protecting from foreign materials entering the airway. The research found that patients with weak or absent coughs can lead to penetration and aspiration as well during their swallow. So the throat clear is a vital way to implement an intervention, also using evidence-based practice. And this would be using our volitional cough. TTS doesn't have much research that actually supports the efficacy of intervention for patients with dysphagia, but clinical evidence does demonstrate improvements in progress over time when TTS is implemented in therapy to trigger an effective pharyngeal swallow. So there is some research and it is expanding for thermal tactile stimulation or TTS, but it is not at the same level of evidence-based practice that we can use the rest of his strategies with.
Although it's not evidence-based practice, I have been using thermal tactile stimulation with a patient at Rancho Los Amigos, and it actually has improved, the quickness of his pharyngeal swallow. So it is expanding, like Nicole said, and I feel like a lot of clinicians in the medical field of SLP have been utilizing it, which has been, very effective with our patients, but unfortunately there's just not enough ethical, or I wouldn't say really ethical, but like current literature that supports using that technique or that strategy. But I think for using it in regards to Mr. Brunswick's case, it would, deem really effective and promote his progress with his rehabilitation. So overall, we did choose those 5 strategies, postures, techniques, and everything in between, because we feel like this would be most beneficial for Mr. Brunswick's goals in speech therapy.